Good evening, everybody. My name's Dr. Jay Myers. I'm the Director of Emergency Services at Olmsted Medical Center Hospital, and I've been in that position since the year 2000. I wanted to share a story regarding a pediatric patient that I saw a number of years ago. And it's not a story about some crazy, serious medical problem, but I think it exemplifies one of the important aspects of the care that we provide. And this was a mother that brought in her child that she was concerned about, and this child was 2 years old. The interesting part about the story was that the child really was not that ill, but the mother was very concerned. And at the end of the visit, I asked her about her child's name because that name was unique, and she proceeded to tell me her story. And her story was that they had come to this country 18 months prior after living in Central Africa. The area that they lived had been ravaged by rebels, and she and her family had seen a great deal of violence. Just prior to this child being born, the rebels had come into their village and all of the men had to leave. She stayed because she was in the advanced stages of her pregnancy. And actually, right at the time of delivery, the rebels were coming back into the base or the camp, or back into the village. This time period was also the monsoons, and there was some heavy rains going on, and she wound up having to flee the village at night in the rain just hours after giving birth to this patient that I was seeing that night. She really did think she was going to survive, or the child was going to survive, but over the next couple of days she made it to a refugee camp where she was reunited with her family. And through that entire refugee process, she wound up coming to the United States. And to be with her as she shared the tears regarding everything that she had been through, and then to see herself in a country where she could bring her child to a place 24 hours a day to get the care and reassurance that she needed was something that she described as miraculous. And while I can't share the name of that child, the name of that child had been given to reflect her gratitude for that situation. It was a very moving situation for both of us, and it reminded me of the importance of having the care that we can provide 24/7 for all people in our community, and especially our pediatric patients. I'd like to take this opportunity to thank the Kids Cup for their support of OMC over the years. We are in the process of building a new emergency department, and we are expanding our care for all patients, and we will have some specific needs for pediatrics, and we know that they're listening to us, and we appreciate everything that they've been doing.